I'm Kelly Phillips. I'm the Skin Integrity Lead Nurse at Doncaster and Bassetlaw Teaching Hospitals NHS Foundation Trust. The literature describes a skin tear as a superficial traumatic wound to the skin caused by mechanical force. However, it can become chronic by the wound not healing, and this could be down to things like infection. For example, if someone gets a skin tear on the lower leg, this can progress into a leg ulcer. The International Skin Tear Advisory Panel has a validated and standardised tool to help and assist you with categorising skin tear types. Type 1 is where we have no skin loss and we can reapproximate the whole skin tear flap. Type 2 is where we have partial skin loss, and this is where we reapproximate the partial skin but still have an element of open wound. Type 3 is where we have no skin flap available and we have full skin loss and we have to manage the open wound. In 2017, the Skin Integrity team developed and implemented a clinical pathway to aid with the assessment, categorisation and treatment of the skin tears. The pathway was evidence-based and enabled consistent interventions to be provided to all patients that developed a skin tear. We reviewed the current ISTAP 2011 recommendations, and within there we reviewed what treatment was recommended. At that time it advised that a non-adherent dressing was recommended for the use on skin tears. Due to this, we evaluated 5 non-adherent dressings throughout the organisation on patients that developed a skin tear. We looked and evaluated the healing outcomes, patient feedback and staff feedback. We found as a result of the evaluation that the UrgoTul Absorb Border had the best outcomes for our patients and staff. This product was selected as first-line use on all skin tears. A visual and instructive pathway was developed with steps for the care provider to follow to enable them to translate the best practice into reality. The pathway starts with first aid requirements, including controlling any bleeding, cleansing the area and reapproximating the skin tear edges. The pathway then continues into treatment through the application of the UrgoTul Absorb Border and onto the assessment and continued management requirements. However, the lower body skin tear section includes an addition of a hosiery 10mm of mercury liner to assist with compression and healing of lower leg wounds. We selected the Altepress 10mm of mercury liner from Ergo Medical as our first line product on the pathway. This was due to the large range of sizes that were available from the range, enabling the majority of our patients to fit into an off-the-shelf hosiery liner. However, it was also identified that the manufacturing is in the UK, and if our patients did require a made-to-measure hosiery liner, that could be with us within a 72-hour turnaround. In addition, because the UrgoTul Absorb Border and the Altepress liner were both manufactured from the same company, this enabled the transition into practice through the support through education from the company to be seamless and effective. The main benefit is the technology lipido-colloid, which provides tender loving care to our patients. The TLC has a gel-like interface that provides and maintains a moist wound healing environment. It's also designed to improve clinical outcomes through a stimulation of fibroblast proliferation and enables pain-free atraumatic removal. You can also reposition the pad, which also helps with the application on difficult to dress areas. As the skin tear pathway was a new element introduced into the Trust in 2017, we developed and launched a Skin Tear Champion programme in partnership with Ergo Medical. This was to enhance the knowledge, competency and engagement from all staff. We reviewed the pathway in 2018 and identified that the ISAP guidance had been updated and identified that the lipido-colloid dressing was the recommended dressing choice for all 3 skin tear types. This provided us and the users and patients with that assurance that we had selected the correct dressing choice to be used within the pathway as first line. The pathway is visual and easy to follow, which enables engagement and improves outcomes for patients. And we extended the rollout of the pathway. This ensured that there was no variation in care for patients with skin tears. We do walk rounds onto the wards and departments and also provide education in different module settings throughout the whole of Doncaster around the pathway and the products. This also offers them the opportunity to ask any questions and enhance their knowledge and skills further. If this is new practice into your area, you may want to start by breaking the pathway down. So this could be implementing the UrgoTul Absorb Border for all skin tears and providing education and knowledge around that. You could then move on to the second stage, where you implement the Altapress liner for lower leg skin tears. By the time you get to the end of that process, you will have implemented the whole pathway in full without it seeming as one big change all at once. One other really useful thing we found with the UrgoTul Absorb Border is that you could actually draw on the dressing itself. It enabled us to draw an arrow in the direction of removal, so we weren't disturbing the skin flap that had been reapproximated, and also place a date on there of the date that it needed to be changed. This assisted with the staff on the ward areas and also patients in their own home to know how to remove that dressing and when. Because UrgoTul Absorb Border is so simple to use, it can be used in many different environment settings. This could be a nursing home, care home, hospital setting, or in the patient's own home, either by a district nurse or by self-care. To summarise, we want to ensure we have consistency in care to reduce variation, to enable the evidence-based practice to be delivered to improve patient outcomes. A clinical pathway is a really useful tool to enable that transition of the evidence into day-to-day care. We found that the ISTAP guidance was a really good starting point to review and take the evidence that was recommended for the treatment of a skin tear. The latest guidance recommended the use of a lipido-colloid dressing on all 3 skin tear types, for example, the UrgoTul Absorb Border. This dressing will enable us to provide pain-free care, promote wound healing and ultimately improve clinical outcomes.